Cubital tunnel syndrome is a condition where the ulnar nerve, which runs down the inside of the elbow, gets squeezed or irritated. Think of it like a garden hose that is pinched. Water or nerve signals cannot flow smoothly, causing problems in the hand and fingers. The main reasons the nerve gets squeezed are bending the elbow for long periods, like holding a phone to your ear, or sleeping with the arm tucked under a pillow. Direct pressure on the inner elbow, leaning on a desk edge. Repetitive movements such as typing, or using tools that force the elbow to stay flexed. An extra bone or thick tissue that reduces space in the tunnel. Typical signs include a tingling or pins and needles feeling in the ring and little fingers, especially when the elbow is bent. Numbness that comes and goes, often after holding a phone or reading a book. Weakness when trying to grip objects, like holding a cup. Try gently tapping the inner elbow. If you feel a brief shock of tingling in the fingers, it's a classic sign called Tinel's sign. Doctors diagnose the syndrome by asking about your activities and checking for the symptoms above. Performing a simple test, ask you to fully extend the elbow and then slowly bend it. If tingling appears, it supports the diagnosis. Sometimes an X-ray or nerve conduction study is used to rule out other problems. Treatment steps usually start with resting the arm and avoiding prolonged elbow flexion. Wearing a soft splint at night to keep the elbow straight. Physical therapy exercises that stretch and strengthen the forearm muscles. If symptoms stay bad, a doctor may suggest a minor surgery to free the nerve. Keeping elbows straight while sleeping, use a pillow to support the arm. Taking short breaks every 30 to 45 minutes when doing tasks that keep the elbow bent. Stand, stretch the hand, open and close the fist. Using ergonomic tools that keep the wrist and elbow in a neutral position. Avoid leaning on hard surfaces with the inside of the elbow. Ultrasound-guided injections of steroid medication that target the nerve more precisely, giving quicker pain relief. Small endoscopic surgeries that use a tiny camera, resulting in shorter recovery time and less scarring. Research on wearable sensors that remind users to straighten their elbows after a certain amount of time.